everybody, welcome to my talk today, answering the question, what is the difference between a quality improvement project and a service evaluation? I've worked as a registered nurse for 34 years and I know that many healthcare professionals and students can become confused with the range of terms that we have in healthcare. We use a lot of management, business speak, leadership speak under the terms quality improvement, quality assurance, clinical governance and change management. So over the next few weeks I'm creating a playlist on quality improvement and change management, and we'll provide some simple videos explaining some of these terms. They are very helpful for interviews if any of you have interviews coming up, because you often are asked questions around these terms. So it will help with interview preparation. And also, if you're looking at a career in research, or you're a student who's being introduced to these terms, you may find the videos helpful. So if any of you've got interviews coming up, I've got a video coming out in the future, quality improvement and quality assurance in healthcare, and it will provide an overview of key terms for all healthcare professionals, so I hope you find it helpful. So first of all, if we look at the similarities between a service evaluation and a quality improvement project, both aim to help improve the quality of care. Both require data collection, and when the data is being collected, the same methods and data collection tools might be used, and this is why people sometimes get confused. So for example, you may use questionnaire surveys and interviews in a service evaluation or a quality improvement project. Both will start with clear aims, objectives and a purpose, and both require a systematic approach. And an example might be the PDSA model that you might have heard of, and this model was published in the 1950s. It came from Deming's quality improvement model that initially was called Plan, Do, Check, Act, and was later changed to Plan, Do, Study, Act. And I'll talk in a bit more detail in one of my future videos about the different frameworks and models that are used in quality improvement. But this is an example of a framework, and there's different frameworks and models recommended in quality improvement. When we're looking at the differences between a service evaluation and a quality improvement project, as the word suggests, an evaluation, you make a judgment on something. So a service evaluation, you're making a judgment on that service. Service evaluation aims to make a judgment on how well things are working in a local healthcare service. You do that usually through feedback from service users, and it could be from patients, from carers, from staff, all different healthcare professionals. An example would be using feedback from friends and family test, where patients submit anonymous feedback on their experiences of a healthcare service. The results from service evaluations provide feedback that can inform future planning in a local service. So service evaluations are usually repeated and you're looking for changes and improvements, so it's cyclical. Employers will compare previous service evaluations to monitor whether quality is improved or whether it's deteriorated, and this is how it links to quality improvement. So in contrast to a service evaluation, a quality improvement project aims to improve the quality of care, so it's similar, but they do this through implementing a change. So for example, a quality improvement project will implement a change to improve patient care or staff experiences, or a healthcare system or a process or a structure. The quality improvement intervention or change should already have been proven to work. So for example, implementing an established, validated quality of life scale or a patient care pathway to improve patient clinical outcomes. So there's an evidence base and research supporting its use and its implementation. And this is where a quality improvement project is different to a research study. In a research study, we might be looking to validate that tool that we've created. We've got a research question and we don't know what's going to happen, what the outcome will be. With quality improvement projects, the tools used should be proven to work. And what we're doing, we're seeing whether it works in this context, in this specific local context. So some examples: a service evaluation requires service user or staff feedback on their experiences. So an example might be healthcare professionals' experiences using electronic patient records. How well does the current system work? What needs to improve from a service user perspective? Whereas a quality improvement project may implement a change to a healthcare system or practice or process. So an example linked to electronic patient records would that we'd implement a change to that system to improve staff experiences when using electronic patient records. So that's sort of an example comparing the differences if we were going to do a project linked to electronic patient records. Additional UK resources and websites that are helpful to look at: NHS websites for quality improvement frameworks, models and strategies. There are many healthcare employers that have quality improvement hubs and local quality improvement leads. We've got lots of national networks and hubs. The Healthcare Quality Improvement Partnerships, an independent organisation led by the Academy of Medical Royal Colleges and Royal College of Nursing. And look on employer websites to review local project work, what's going on, what service evaluations and quality improvement projects can I start linking to and observe. If you're a nursing student or an early career nurse, I have a video on different research nurse roles and how to become a nurse researcher, looking at research nurse career pathways, quality improvement and service improvement projects for nurses on another video with some example projects. And I will be developing a quality improvement and change management playlist on my YouTube channel. And quality improvement and service evaluations are a great way to get started, to see whether research is for you or quality improvement and assurance roles are for you. So if you have any questions at all, put them in the YouTube comments and I will answer them. If you prefer to ask questions privately, you can DM me on Twitter or on my website. Good luck with any projects you pursue in the future or become involved with. And if any of you are interested in buying my books, you can see the links on below in the description on YouTube. How to prepare for interviews and develop your career, and how to thrive as a newly qualified nurse.